Like all other tissues in the body, the heart muscle needs oxygen-rich blood to function. Also, oxygen-depleted blood must be carried away. Coronary arteries supply blood to the heart muscle. It plays a vital role in keeping your heart healthy. Any coronary artery disorder or disease can have serious implications by reducing the flow of oxygen and nutrients to the heart muscle. A coronary angiogram is a procedure that provides doctors with a better understanding of the arteries, which provides X-ray images and videos, which are useful in detecting the existence of any coronary artery blockages. A small amount of hair may be shaved from your groin, wrist, or arm. Then, the area will be numbed with an injection of a local anesthetic. A small incision will be made at the entry site, and a short plastic tube called a sheath will be inserted into your artery. The doctor then will navigate a narrow tube known as a catheter up to your heart via the arterial system. Once at the heart, the doctor will direct the tube ending so that it is pointed at the entrance to one of the main coronary arteries. The tube's progress is monitored by an X-ray machine. Contrast dye will be injected through the catheter. You may have a brief sensation of flushing or warmth. This special dye makes it possible for the X-ray machine to clearly capture how well the coronary arteries are supplying blood to the heart and identify any blockages or constricted areas.